This bloodborne pathogens training provides health and safety information to anyone handling blood or other potentially infectious material as regulated by the US Occupational Safety and Health Administration. This bloodborne pathogens training is required initially at higher and annually after that. Bloodborne pathogens are microorganisms that could cause disease in humans. They are found in human blood or other potentially infectious materials, which may include body fluids such as saliva and urine. OSHA regulates bloodborne pathogens under Title 29 of the Code of Federal Regulations in Part 1910, Subpart 1030. The university maintains a list of job classifications for employees who may have occupational exposure to bloodborne pathogens. This training is a requirement for all employees who work in these jobs. An annually updated exposure control plan is maintained for all bloodborne pathogens and is available on the university's website. Common bloodborne pathogens include hepatitis B virus, hepatitis C virus, and human immunodeficiency virus or HIV. Both hepatitis B and hepatitis C may cause inflammation and damage to the liver and possibly even death. Hepatitis B virus remains viable on environmental surfaces for at least 7 days. Hepatitis C virus can survive on dry surfaces and equipment for up to 6 weeks. According to the Centers for Disease Control, the primary occupational exposure for hepatitis B is through a needle stick, resulting in up to 30% chance of infection. There are approximately 3,000 new hepatitis B cases each year in the United States. A vaccine is available for hepatitis B. Contact Campus Health Services or your health provider for more information. Training and vaccination within 10 days of the initial assignment are available to anyone who has a potential for occupational exposure to bloodborne pathogens. Consult with your supervisor for details. Hepatitis C virus causes both acute and chronic infection. Around 30% of infected persons spontaneously clear the virus within 6 months of infection without any treatment. The remaining 70% of persons will develop chronic HCV infection. New HCV infections have increased each year since 2013 to 57,500. Estimated infections in 2019. There is no available vaccine. A recent analysis of several studies revealed an overall 0.2% risk for infection following percutaneous exposure to HCV antibody positive blood through needle stick or sharps injuries. HIV may lead to acquired immunodeficiency syndrome, AIDS. HIV is transmittable in any stage of the disease. Early symptoms include fever, headache, body aches, and weakness. Some patients remain asymptomatic for years. Untreated HIV weakens the immune system, leading to the decreased ability to fight infection or death. In 2019, 36,801 people received an HIV diagnosis in the United States. HIV does not survive long outside the human body. There is no available vaccine for HIV. According to the CDC, the risk of HIV infection after needle stick is less than 1%. Bloodborne pathogens may be present in other potentially infectious materials, including unfixed human cells, tissues, organs, or bodily fluids such as semen, vaginal secretions, cerebrospinal fluid, any body fluid that is visibly contaminated with blood, and all body fluids in situations where it is difficult or impossible to differentiate between body fluids or objects that have been in contact with these materials. Universal precautions is an approach to infection control where all human blood and other potentially infectious materials are treated as if they are hazardous. Always use appropriate safety equipment and practices when handling these materials. Safety equipment includes biological safety cabinets, sharps disposal containers, self-sheathing needles, and other safer medical devices. When handling potentially infectious materials, always wear closed-toe shoes and appropriate clothing covering arms, legs, and torso. Securely fasten any long hair, loose clothing, or dangling accessories. Rings should be removed and long nails are not permitted. Lab coat, gloves, and eye protection are always required. The OSHA Bloodborne Pathogen Standard 29 CFR 1910.1030 requires that workers have safety equipment provided at no cost. Consult your supervisor for questions about PPE. Biohazard symbols are used to identify containers and items which may come in contact with bloodborne pathogens. This includes instruments, refrigerators, freezers, and containers used to store, transport, or ship infectious materials. Individuals must be trained and prepared to respond to biological incidents. The university does not have a centralized biological spill response team. Call 911 if an incident is life-threatening. Seek medical attention for any exposure regardless of severity. Report all biological incidents to Environmental Health and Safety. Medical treatment is provided for all work-related exposures at no cost to the employee. All medical records are confidential. All incidents with potential exposure to bloodborne pathogens must be reported to your supervisor and EHS promptly. For more information about incident reporting, contact EHS. Additional information is available from OSHA at osha.gov or 800-321-OSHA. The OSHA Bloodborne Pathogen Standard does not cover Good Samaritan Acts. Contact EHS for further details. To receive credit for this training, complete the test with a score of at least 80%. For questions or assistance, contact EHS.